Dear friends, recent COVID pandemic, the new virus with no one on earth being immune to it, brought up subject of importance of vaccination. It's a safe way to get natural protection from serious illnesses, complications, or even death without actually to be ill, to suffer, first exposed. First vaccination efforts were performed over than 1,000 years in Asia and East, when people tried to use the survivor's blood in different ways to protect other members of community to catch the infection. First official immunization program was designed and started and promoted by British doctor Edward Jenner in 18th century. Dr. Jenner designed the smallpox vaccine to prevent the smallpox epidemic. It was one of the world's most devastating illnesses, highly contagious, disfigurating, and often deadly. In the middle of 18th century, the vaccine was widely promoted by this doctor, and even he was vaccinated himself, believed to be when he was just a boy at the age of 7 years old by another doctor. Nationwide, smallpox vaccination ended up the spreading of one of the deadliest beasts. Over the 200 years of history, medical, social, even psychological aspects of vaccination been changed. Lately, different celebrities, scientists seeking for fame, or even religious leaders creating a fear of autism, neurological disorders, mental retardation connected with recent vaccination. The most controversial in this regard was the measles and pertussis vaccines. The measles and pertussis are the reasons of the many recent outbreaks because of people afraid to vaccinate their kids. In 1998, the most famous anti-vaccinator, Dr. Andrew Wakefield from London, proclaimed strong connection between autism and measles vaccination. This is something which was later figured out to be fake. The doctor was trying to promote his own vaccine instead of traditional one, so it was clearly for commercial reason and for reason of popularity. Till now, continuous researches in this field did not prove any correlation between autism and any vaccine. But outbreaks of measles and parotitis are happening every year. Of course, each parent has different perception and different opinion about vaccination. If parent choose not to vaccinate, we must inform him that unprotected child is in the risk to catch infection at any moment of its life, socializing, playing, or traveling. During outbreaks, child must be excluded from the school schedule and any other social events with other kids. What we have to do, we have to inform parents and adults as well about vaccines' adverse effects. First is that there is no any proof of connection between vaccination and autism or mental retardation. Second, of course, adverse effects are happening. They can be divided in three major groups. First one is local, like redness or swelling or local pain in the site of injection. Second is systemic reaction, like a fever. And the third is allergic reaction. The allergic reaction on vaccines is actually more common for adults, like syncope, anaphylactic reaction, Guillain-Barré general paralysis, regarding to recent influenza infection. All this, yes, happening, but extremely rare, like Guillain-Barré syndrome in adults. This is a serious generalized paralysis after the vaccination of influenza, has frequency 1-2 cases per 1 million doses. So for Cyprus is not even applicable. I want to show you this table. This table is the adverse reactions of different vaccines. Of course, we are talking here about serious adverse reactions. I will publish this also in my Instagram for you to see better. As you see, like serious allergic reaction of diphtheria, tetanus, and pertussis is just 1 per 1 million doses. But what is potential allergen? Is the syringe contains latex, measles, mumps, and rubella. Here we see some serious allergic reactions with a frequency less than 1 per 1 million doses. Why? Because they contain neomycin and gelatin. The one of our ex-favorite vaccines, the Priorix V, Priorix Tetra, it's a measles, mumps, rubella, and varicella. Indeed, it was noticed that they can cause the febrile seizures in kids in a frequency 8.5 per 10,000 doses. This vaccine currently being stopped. We are not vaccinating the kids with all four. We do it separately instead, free and varicella separately. So I will put this in Instagram for you to have a look how actually frequent are the adverse effects, the serious adverse effects in the kids after vaccination. So, recent immunization scheme, the present immunization schedule, is recommended by World Health Organization since 2004. Till 1 year of life, each child should be vaccinated against minimum 12 dangerous illnesses, starting from birth or 2 months age. Yes, the tuberculosis vaccination and hepatitis B vaccination, due to epidemiological indications, we are starting from as soon as 12 hours of life. Diphtheria, tetanus, pertussis, dangerous illnesses, everybody in risk, especially in our days, due to migration of population and partly due to anti-vaccinations and anti-vaccinators movements and influences. Haemophilus influenza, pneumococc, rotavirus, meningitis, they are highly pathogenic microorganisms causing severe illness in small kids, pediatric age group below 5 years old. MMR, measles, parotitis, rubella, we discussed it already. And of course, it's HPV, human papillomavirus, which protects women of young age from cancer, cervical cancer, the reason of death of many famous women in the past. Seasonal influenza is highly advisable for kids less than 5 years old and adults with chronic health problems. Finally, I would like to mention that there is no actually contraindication for vaccination. The temporary contraindications are more common, and these are fever and some severe immunity impairment. When this impairment will be taken care of, will be improve the condition of the patient, we can resume vaccination schedule. The permanent contraindications is severe anaphylactic reaction, anaphylactic shock on particular vaccine. So, dear friends, if we have to answer for vaccine, to be or not to be, to vaccinate our child or not, to get this recommendable by our doctor vaccination, the answer is to be. Thank you very much.